Right. Hello, everybody. Hey, Danielle. How are you? All right. So we're going to go ahead and get started. My name is Brittany Cano. For those of you who don't know me, my background is in nursing, and I got into wellness and coaching about 10 years ago because I was struggling with my health, my mental health, my physical health, and working in ICU just saw so many people in our hospital system who could have avoided being there through preventative care. So it really inspired me to want to prevent people from ending up in the hospital and also to live well. So today we're going to talk about the power of peptides as well as how combining it with holistic health is really supported. So in today's webinar, we're going to explain what peptides are and how they work at a cellular level, highlight evidence-based benefits, energy, weight management, recovery, healing, how they can support with hormone balance, and learn about safe medically supervised peptide protocols, and then also inspire the integration of it with lifestyle medicine. So nutrition, movement, stress reduction. So what is wellness? I think that's a question that, it's such a word we hear all the time, wellness, health, but really what is that definition for you? What does it mean to you to live well? Wellness might be your health journey and more than just managing the symptoms that you're having, right? It's really having vitality, really having quality of life and deeper connection to yourself and to life in general, to your loved ones, to something greater than yourself. And I like to look at wellness through the lens of holistic. So, through the lens of physical health, mental health, emotional health, spiritual, our relationships, our connection to life in general. And then I like to think of wellness as proactive, right? What we do now will affect us in the future, and really how can we optimize our life and how can we optimize our health? So, what are peptides? It's really simple. Our body is made up of peptides. They're small chain amino acids that are amino acids are the building blocks of protein. And what they do is they're keys or they're messengers that help activate specific healing benefits in the body. So what I love about it is that our body recognizes it because we have them naturally occurring in our body, but through injury, through age, through traumas, through our standard American diet, through all of the stressors that we're exposed to on a daily basis, all day long, peptides can decrease, they can get damaged. And so when we take prescription grade peptides, what it does is it's like a little key to turn on specific healing mechanisms. So it really just accelerates our healing, accelerates our wellness. There are over 60 peptide therapies, and many are FDA approved. And typically they're very well tolerated, again, because they're naturally occurring in the body. I also like that they can get to the root cause. So a lot of times in traditional medicine, you're taking a pill, we'll say, and it's treating a symptom. It's treating the blood pressure, it's treating the cholesterol, it's treating the autoimmune condition. And a lot of times, as we know, there's also a lot of side effects to those. And now, listen, I'm not knocking all the pharmaceuticals. I know they have their place in their time. And sometimes a lot of times they're not really getting to the root cause of what's going on. And I like that peptides really are deep, functional, integrative healing at the root level. They're also great, like TB500 and BPC helps decrease inflammation and accelerates recovery. That's actually one that I'm going to be starting it here very shortly. It's shipped. I'm just waiting to receive it. I'm starting on the BPC 157 and TB500 because I'm somebody who I'm sore all the time. And y'all know, if you know me, that I've been exercising regularly for a long time, but I feel like almost every workout is the first one. And that tells me that I probably have a lot of inflammation in my body. I also deal with gut issues, and it's really great on healing the gut. And with the BPC 157, there's also neuro, so brain support as well with that. Peptides can optimize hormones at a cellular level. So instead of like taking growth hormone, and let's say if you're taking an external source of growth hormone, your growth hormone levels could potentially get to a crazy high level, which could be dangerous. What peptides such as sermorelin, tesamorelin, ipamorelin, what they're going to do is they're going to go in as messengers and activate your growth hormone, but there's like a natural checks and balances that happens in the body. And those peptides, for example, those growth hormone stimulating peptides, they help muscle prevention. So think about preserving our muscle mass, building muscle mass, fat metabolism, longevity, and then also really targeting that visceral fat. And they also peptides can advance our vitality, our energy, our sexual health as well. And that's something that a lot of people don't talk about. But as we get older, for many people, sexual changes happen, libido can drop, amongst other things. And so things such as the PT1 for one or the thrill pill help activate these hormones in the body so that sexual health increases too. And connection, right? It's one of the most important things for our quality of life is connection. So I want you to just take a moment and reflect if any of these apply to you and to really be honest if you're having any symptoms at all of these. And maybe you don't experience this on a daily basis, but maybe a couple times a week, a few times a month, just so you can really do a check-in and see what symptoms you're having. So then when we go through what the peptides are, you can get some information and educate yourself which ones would be supportive for you. So do you experience any low energy, or maybe you're just somebody who's constantly tired? There's weight. Like if you heard my interview with Kelly yesterday, she was doing all the right things, college athlete, exercise, eating well, and yet she was overweight. And so the GLP-1 for her was amazing at helping her release that extra weight that no matter what she was doing, she couldn't get the weight off. And I can't tell you how many clients I've worked with over the years who they're doing everything and they're just frustrated that their body's not responding to the healthy eating. Their body's not responding to exercise, and they're heavy strength training. They're drinking plenty of water. They're moving throughout their day. Sometimes we might have a increase in cortisol. We're in that fight, flight, or freeze in our bodies. No matter what we do, as far as these activities go that I just mentioned, the body won't release the weight. And so again, that's why it's going to be important to combine it with holistic wellness practices. But peptides can be a really great tool if you're having a hard time releasing weight, or if you have food cravings. If you heard my GLP-1 webinar the other day, I talked about how I've struggled with that. I have so many clients who struggle with that, and what a nightmare it is when all we think about is food, when it's like the forefront of everything. So imagine what freedom and liberation that opens up to not have such intense food cravings and food noise. Do you deal with brain fog? Or maybe it's hard to focus. Is it hard to recover? Are you like me, right? Where you're like sore all the time, or you have an injury? Frozen shoulders common as we start to go through perimenopause. Hip issues can be another thing. Maybe you were an athlete at one point in your life, you have old injuries, or maybe you've taken a fall, or you're dealing with knee issues. That's another reason I'm starting on the BPC. From all my hiking this past year, even though I've been in physical therapy and it's gotten a lot better, there's still some things going on in my knee, and I really want to give my body the best that it can handle because I want to enjoy my life. Do you deal with joint pain, stiffness, inflammation? Do you have low libido? Are you struggling with intimacy? Maybe you're not sleeping well, or even if you sleep 8, 9, 10 hours, you're still not feeling rested. Are you moody, right? Are you feeling like that cortisol overload where your adrenals are just maxed out because you're like constantly going and taking care of everybody else? Are you irritable? And just in general, are you noticing like, okay, aging is catching up with me? And if there's something I can do that's natural to support myself in the aging process, so I age gracefully, why not, right? And I just really want to encourage you. This is something that took me a long time to understand and to believe and to know, but I know it to be true that our symptoms are gifts. They don't feel like it. I get it when we're really struggling, but they are gifts, and they give us really important information like, hey, look at me, pay attention here. And one of our roles that we can do is really be like a loving detective and advocate and go on the journey of, okay, what is my body trying to tell me? What does my body need? And that's why having somebody in your wheelhouse who's this is their expertise, like myself, can be really helpful too. So I want to talk to you about some of the peptides. And again, the symptoms that you're having, what some of these may be helpful with, as well as if there's areas of your life that you really want to optimize and elevate, right? There doesn't necessarily have to be that there's a problem, but you want to be proactive in these areas. So the GLP-1s, I did a webinar last week that you can see and review as well, or I can send you the link. Think of your semaglutide, your tirzepatide. There's also other ones, and they're coming out with even new GLPs are on the market. What they do is they mimic natural gut hormones. So again, naturally occurring in the body, and they help regulate our appetite, help keep you feeling fuller longer, delay gastric emptying. They also quiet the food noise. They work also on that gut brain connection, and they stabilize glucose levels. So they also regulate metabolism. And if you follow anything in the inflammation world, we want to have regulated glucose levels. And unfortunately, our American lifestyle, many of us are having these glucose spikes throughout the day in crashes, and it's really wreaking on our health, overall health. So the GLP-1s can support with weight loss. They're also finding out now that it's protective of the heart, can even be protective of the kidney, that there's these anti-inflammatory benefits as well to it. And I think we're going to find more and more benefits to it when used safely and combined with lifestyle. Also, they're starting to see that for people who struggle with addiction, that it's off label. Obviously, it's not promoted like that, but because it works on that craving center of the brain, that it can potentially, we're going to see more in that area as well. Then there's the BPC 157 and the TB 500. So what they do is they help new blood vessel growth, they reduce inflammation, and help with the collagen formation. So you can think your skin, you can think your organs, your tissues, your ligaments. They have that brain protection, that neural protection, and brain repair as well. So benefits of that are faster healing of muscles, of tendons, ligaments, and gut lining. Can also be great if you're post-op or if you have a surgery coming up. I had a client of mine, who was having extreme gastric, like heartburn, extreme GERD. And within a month of being on BPC, he said less than a month, it went away. I had another client who extreme back pain, going to the chiropractor, doing PT, even taking pain medicine, and a ton of pain. Within a few days, his pain was almost completely gone. So, of course, results are going to vary depending on if it's a chronic issue, if it's an acute issue. There's all these other things that take into consideration, but something I'll have more to share about with you all soon too, about my own experience with it. Pain reduction, improved mobility, cognitive support, and brain resilience. So things again to think about. If you have any sports injuries, could be pickleball, golfing, post-surgical recovery, joint pain, musculoskeletal, gut health. Think of irritable bowel disease, leaky gut, and then brain conditions as well. Then we'll move on to the GHKCU, which is a copper peptide, and again works on the hair, skin, and nails, so it can help with firmness, reducing wrinkles, hair growth as well, and can also help with tissue healing and recovery as well. Kelly, if you heard our interview yesterday, was talking about she's just had really creepy, just dry skin, and noticed such a difference in her skin, that she's having a lot of new hair growth as well. So that can be a great one for that. And then we'll move down to the PT141 and the thrill pill. So the thrill pill actually contains oxytocin and tadalafil. Hopefully I'm saying that right. And what it does is it boosts desire in the brain, and it enhances bonding. Oxytocin, we know, does that. And it improves circulation. So this is really going to be great for sexual intimacy, somebody dealing with erectile function. As we know, those medications for erectile dysfunction have a lot of side effects. So this is something, again, that's naturally occurring in the body, decreases with age, trauma, injury, that kind of thing. And so this naturally supports these actions in our body and increases, like I said, desire. So we all know how important sexual intimacy is to our intimate relationship with our partner. So I think that's something that's so important. Then we're going to go over the growth hormone releasing peptides like sermorelin, tesamorelin, ipamorelin. And what they do is they help your body stimulate growth hormones. So these you're going to take at night. It also targets that visceral fat. I know I've had clients that, again, checking all the boxes, and they're lean and they're fit and they're strong and they're great shape, but still that visceral fat is really stubborn. And we know that that's the most dangerous fat to have over our organs. It puts us at a higher risk of disease and a higher risk of getting sick. And we want to avoid that, of course. So it really targets that and increases our metabolic function. So with that, as we age. I think it's after 30, our muscle mass starts decreasing up to 3% a year. And then the older we get, that number increases even more if we're not doing things such as strength training, getting high quality protein, weight bearing exercise, all those things. So this is going to help preserve your muscle mass, build muscle mass, great for your energy levels, recovery, your physical performance, and also for sleep. So if you're somebody who's struggling with sleep, and we know that sleep is such a healing mechanism and supports our entire health, can't emphasize that enough. So these are ones to look, peptides to look at there. I mean, for somebody just like no matter what you do, you can't build muscle, look into these ones as well. Look into these peptides. So what I really love about being in the peptide space is that I just cannot emphasize enough how this is a beautiful tool and how synergistic, how important this all goes in with lifestyle medicine. So we're going to talk just a little bit about lifestyle medicine, about holistic integration. This is a lot of work that I do with my coaching clients. And if you come to workshops or retreats with me, we dive into this deeper. So the nutrition piece, the peptides are going to help. They really are amazing tools. And like you want to get the most out of it. Nutrition is gonna, that you are what you eat. There's a lot of truth to that. So again, making sure you're getting about 30 grams of protein with your meals, getting the phytonutrients, so eating the colors of the rainbows in real food, fruits, vegetables, uh, eating anti-inflammatory. Like I said, I've realized that I have inflammation in my body and I'm really leaning more towards eating more anti-inflammatory. So I'll be sharing with y'all what I'm finding works. And, once we start to feed our body what it really needs, that also helps with the gut flora, that can help with the cravings, help with energy, help with so many things, right? Movement. We are meant to move. We are designed to move. When you look at the blue zones in the world where people live to be greater than 100 years old with quality of life, they're moving. They're moving every day. They're in the garden. They're walking up the hill. We're in Florida. We don't have too many of those. They're getting their hands dirty. And even 150 minutes of exercise a week, moderate, can reduce our mortality rate by up to 33%. So that's pretty impressive. We can't emphasize enough, like sitting is the new smoking, and we have to make sure we're moving and also make sure that we're strength training. It is the absolute must for so many reasons. And one thing at a time, right? I like to think of peptides can be a really great tool to start to have you feel better. Because sometimes when we feel like crap, when we have no energy, when we're inflamed, when we have a low mood, when we're 30, 40, 50 pounds overweight, it can be really hard to get even going. And so I think that using peptides as a foundation can be just so powerful on your journey. Sleep, we already talked about that. The growth hormone peaks during sleep, during deep sleep, and just one night of poor sleep, right? It can reduce our insulin sensitivity up to 30%, which is pretty high when you're considering that's just one night. And what we want to avoid is we want to avoid insulin sensitivity or reduce insulin sensitivity. We want to have insulin sensitivity. That's a good thing. Mindfulness and breath work. And I just invite you, I've been chatting a lot. Let's just take a moment of breath. Just if you're doing something else, maybe just pause for a few seconds with me. Lengthen the spine, become aware of the breath, maybe drop the shoulders, soften the jaw, maybe even soften your gaze if you're not driving. Starting to expand the breath, take a deep inhale through the nose, let the belly rise, chest expand, and a slow, calm exhale out through the mouth. Let's do two more of those. Deep, full breath in, just becoming aware of this moment to moment experience. And let it go. One more time, filling yourself up, full breath in. And then letting it go. During that deep belly breathing, we activate the vagus nerve. So when we do that, it helps lower that cortisol. It helps balance the nervous system, helps activate the parasympathetic, that rest, digest, heal part of the nervous system. And breath work can even decrease the inflammatory cytokines and improve our HRV. So lifestyle medicine, It's going to help us really just taking time away from your phone, taking time to do things that have you feel grounded, getting out in nature, anything that brings really quality and wellness to your life is going to be so important on this wellness journey. And if you're struggling right now with your health, or there's that little whisper like, I need to add something else. Like I really want to make sure I am focusing on quality of life and longevity. I'm going to encourage you, follow that curiosity, lean into that. This is one of those things when we invest in our well-being that we're not going to regret, right? It's just, we got this one precious life, like I always say. So when it comes to peptides, I want y'all to be very aware that you are getting your peptides from a safe source. You may, if you see this video, start seeing things about peptides everywhere. And there's a lot of research grade, lab created, unregulated, not for human consumption peptides out there. And as a nurse, I cannot even begin to say that I would never recommend that to you. And like I said, there could be in the previous, in the last webinar, there could be companies that are okay. I don't know, but I want you to have quality. I want you to have safety. And I also think having medical supervision is also important. And that's why this is the way I've chosen to offer peptides, because I feel that this is what's safest for you. So I love that when you work with me with peptides, you're going to have medical supervision. You're going to have my support as a nurse, as a holistic lifestyle coach, but you're also going to have an upper level provider who is going to be there that you're going to have access to. And that's really important. You're also going to have a patient portal. You're going to be working with the pharmacy that is NABP accredited and that also does third party testing. So, for example, the GLP-1s through my pharmacy, they are 114 to 117% potency. Some, you may be getting a 50%, a 30% potency on your GLP. Maybe that's why in some situations people have a hard time losing weight or have, a lot of side effects, those kinds of things. So that's something I feel is very important. And not to say that you won't have side effects, right? Not to say that everybody's journey looks different. There's people who it takes 6 weeks on a GLP-1 before they start releasing weight. And I think it's important to honor your journey and know that everyone is their own unique individual with unique biochemistry and the unique lifestyle, all of those things. I also love that there is community support with this. And there's the option of FSA and HSA finance, and then also financing options. So the health flex spending, as well as if you wanted to finance it. And there's 0% finance on some of the options as well. And like I said, you'll have Mia in your corner and Mia support. So what are the next steps? If you're hearing this and you're curious and you're like, oh my gosh, I think I want to know about peptides, sign me up, let's get started. You have a couple options. You can book a free peptide consult, which I'll include the link, or I can send you my site. You can look around and you can order them. The process is super simple. This is another thing that I absolutely love. You're going to go online, you're going to fill out your medical history. If there's anything that is cause for concern, the provider is going to reach out to you and review that with you. If you're overall healthy, nothing is a flag, then you're going to get approved. You're going to upload your ID because we want to make sure you are who you are. And you're going to get the peptide shipped directly to your house with all of the supplies. It's very simple, easy peasy. Absolutely love this process. Think that this is the future. This is the way to go. So feel free if you are interested in learning more, or if you just would like a little more education, please let's connect. I'm here for you. I'm in your corner. And I thank you for joining today. If you felt like this was helpful, if you feel like maybe somebody else needs to hear this information, please share this Zoom. Please share this recording with them. And I really just want you to remember that the human body, I saw it every day when I worked in ICU, and I still see this with my clients. Miracles happen, rapid healing is possible. Like the human body is incredible, especially when we give it the right conditions to flourish. So With that being said, I thank you so much for joining us today, and I hope you have an absolutely wonderful day. Thanks for joining.